Hey everybody. So I just finished my series on movement, and so now I'm continuing on to talk about other parts of healthcare as I promised. And one of the ones that I kind of introduced in my last video was about complementary therapies, but we call them, or some people call them alternative. So I want to clear something up, and this is really important, is that there is this divide among healthcare professions, and this is from both camps, so to speak. So I have spoken to naturopaths who ask me some questions around nursing, and it tells me that some of them don't know what nurses do because they ask me if I know how to. Sorry, I'm having my cup of tea here, so they asked me if I know how to start an IV, and I thought that was kind of a funny question to ask when that's kind of sort of part of what we do as nurses. They were like sort of wondering what I do. And and I mean, not to say that they don't know their work, they're very good at it. I also find that some physicians, for example, do not appreciate that patients, let's say, go see a naturopath or see an osteopath or chiropractor. They go, I don't know what do they do? Is that any good? Now, if we look at research, there is more research in certain alternative and complementary therapies versus than other ones. And I really want to bring that up because there is actually a lot of research in particular ones. So for example, one of the really well-known ones is called therapeutic touch. It started in the 60s, actually in New York, by Dolores Krieger. She did work with others, but she was really the one that sort of brought it into nursing. And she was a professor. And I think the initial one was through a neonatal ICU. And one of the things that they found was that when they used therapeutic touch on these neonates, they were thriving. And so everyone learned how to do therapeutic touch. And everybody was doing it on these babies because they were doing really well. And one of my professors at McMaster University actually was doing some studies, and she was also a practitioner. So that's how I ended up actually learning, because she did a little demonstration to us through our educational group in McMaster University Nursing Society. This was back in the 80s, so this is quite a ways back. But that was my introduction. And here I am, third-year nursing students going, wow, this is amazing. And so it caught my attention. And it caught my attention for two reasons. Number one, it didn't cost anything, meaning the cost is just I learned how to do it. But I'm not giving anything to the patient, meaning I'm not giving them any medication, any IV. All I have to do is be present and put my hand on them. I didn't even have to put my hand on them, but be near them. And if nothing else, I was with the patient for a longer period of time. Now, any of you, if you've ever been in the hospital, would appreciate the presence of a healthcare professional for a longer period of time to hold your hand or to talk to you or listen to you or be present with you. And that in itself has a therapeutic effect. I remember there was a study done years ago where they found that when physicians, even in ICU, a lot of times they would talk at the foot of the bed about patients, or in any unit. They would be outside the room talking about who's in the room, but nobody actually went in and said, hi, Mr. or Mrs. So-and-so, we're actually talking about you out there. And I remember this particular physician said, hey, somebody go and say hello to the patient and tell them that we're here talking about them and ask them how they're doing. And so it's fascinating how, just basics, because people get so involved in what the problem is that they forget that there's a human being at the other end. Now, I'm the kind of nurse that didn't forget that, and I would certainly include the patient in these conversations, or tell the patient, you know what, we're in the ICU and we're going to be talking over here. We're going to talk about you. If you have any questions, let us know. Even if they were intubated, meaning there was a tube down their throat, they can put their hand up, or sometimes they could write things, because this is about them. And so we didn't forget about that. And that's really important. But that's the key piece about this complementary or alternative therapies, is that when we were applying it like therapeutic touch or Reiki at the bedside, that we were able to stay longer. And that did have an effect. And they did feel like, okay, there's somebody here actually, looking after me. So having said that, there's so many different kinds that is considered complementary. Or there's another cat here now. Sorry, all the cats are visiting. So this is now Max. Hello. Say hello. He's just looking for stuff. And one of the things that I think I'm talking about Reiki and all these things, and it's a very good energy. So the cats love it. Animals actually love anyone that I have animals following me, and same with dogs and cats. They just love the energy of it. And they're also much more open to receiving that energy or the healing energy. But the idea is that, here we go. The idea is that with these therapies, is that it's not just for nursing. I mean, lay people learn how to do this, but so do, let's say, physiotherapists, massage therapists, chiropractors. Who else have I seen? Physiotherapists, occupational therapists. I know physicians who have either therapeutic touch or Reiki. But the other thing that's really has exploded because of the research component, because it has been researched very thoroughly, is actually acupuncture, traditional Chinese medicine and acupuncture. And it does have its own regulated college. And we'll talk about that separately as well. But the purpose of this conversation I'm having is that to let you know and sort of educate the public that these are all practices that you can take a course in and get certified. And I teach, for example, I teach Reiki level 1, 2, and 3, and to become a Reiki teacher. And the beauty of it is that, like I said, it can be applied in any setting beside for the patient, and it can be comforting, but also can have some therapeutic effects, such as decreasing anxiety, decreasing stress, and maybe even modulating their pain or decreasing pain. I've used it in burn patients, especially therapeutic touch and Reiki, and it does work. And what that means is the patients may need less pain medication, which is wonderful because less pain medication, they may be already on a lot of other medications. So the thing is that I'm trying to introduce here is the idea that as much as they're regulated health professions, within those health professions, there are other modalities that these professionals can use. They are taught and get certified. So they're not just, okay, I'm doing this, they're actually taking a course. And there's many different types. There is a wonderful book out there called Vibrational Medicine by Dr. Richard Gerber. And he's an internal medical physician who wrote the first book, I think, in the 90s, in 1990s. And that's when I was reading about this. And, or maybe it was earlier, but he has written or has new editions come out. I will leave the reference in the subject or below in this video. But if anybody's interested in it, they can certainly read that book, and it is very in-depth. It goes into quite a bit of physics, actually, and how these things work. And he cites a lot of research that has been done in a lot of the different types of modalities. And I mean, he includes things that I don't even use or have never used. So there's a lot of different things, but he certainly goes around the world, all the different type of modalities that exist. And a lot of those things now are common knowledge, or sort of people use the terminologies like chakras and in yoga, for example, or Bach flower remedies. I mean, years ago, nobody even knew about them. There's so many different types of these type of remedies, essential oils, radionics. I don't even know. It's like some stuff I never even heard of, really. I'm just sort of learning more about it myself. However, having said that, sorry, I have the hiccups. Having said that, the idea is that we have choices. And my view is you can choose to explore different types of therapies. Sorry, my cat hairs on my nose. But as you do these different types of therapies, you want to make sure that they're trained by some sort of institute or a professional or someone that has been certified, so that you know that what you're getting is you're actually getting someone that's trained. And I'm very concerned about that because recently I've seen a lot of advertisements for certain type of modalities, and it's marketed in a very specific marketing way. And actually, I can't even do that as a nurse because it's not allowed. And a lot of healthcare professionals can't advertise in that way. So be very careful taking courses that just pops up all the time. Really research it. And a lot of times, if it's $19 or $19.99 or oh, it's only $50 and you're going to be doing all this wonderful things. Just sit back a little bit and think about, well, who is this person? Do I get one-on-one time? Is it demonstrated to me adequately? And will they supervise me? Because one of the biggest things is that there has to be some kind of ethical model in how they're actually teaching you and how you're going to apply it to patients, and that they do teach some sort of confidentiality and privacy, as well as some kind of documentation. So there's a whole model, there's a whole policy around what they're actually doing properly, versus just here's a bunch of CDs, here's a book, and go do it. It's a little bit more than that. And there needs to be some kind of one-on-one, or at least supervision in a classroom setting, so that actually you're being observed, that you're doing it properly. And as a registered nurse, I can tell you, nurses get observed how they're actually doing something, either by an instructor and also by nurses while they're in training. And so that they have an opportunity to be supervised in all the skill sets, because we don't just send somebody out and there you go. You need to actually demonstrate that you can do certain things, right? So this is all about this segment, and I'm kind of introducing sort of new segments, is that number one, there's a number of healthcare professionals that can practice complementary alternative at the same time as they're practicing their respective profession, but within a certain limit and reason, so that it is okay. There are what I would consider not ethical, or people that have no training at all. And I don't think that there's anything wrong with someone that there's other types of healing, like spiritual healing or praying. I don't think there's anything wrong with that. I think you just have to use a certain type of discernment, because I cannot say to someone what you believe in. If you go to a church or you belong to a group, that you pray for each other, just prayer works. Actually, that's another option. And there's a lot of research around meditation and meditating for a cause, that it actually does work. But more so that if it's being done, that there is no big promises being made. None of the modalities that I have said or just mentioned here can say they will cure anything specifically. Most of them are used as an adjunct, meaning added on to assist with something. So just because somebody is doing Reiki, I can still do it for, like, let's say someone's nauseous because they're getting chemotherapy, or they are nauseous because they just started eating or being fed because they had surgery. So then we can help them with that. So the point is to remember, it can be added on, or it can be used for specific things, but it's not a cure-all. And nothing is a cure-all. And in the end, no matter how you look at it, and this is my personal opinion as an RN, as a human being, is that we can heal and we can get better, but it is also our mindset. We have to believe that we can, and we can. And this is very much, whether it's mental health or physical health, our belief system that we can and it is possible has great power over how well we will do. And I think a lot of my friends who work in healthcare or in healing modalities will say that it does matter that we believe in our own ability to be better, to heal, to be optimally functioning from day to day, and that we can heal and feel whole as a human being. And of course, that brings us to mental health as well. And a lot of these things also are helpful for mental health, because if, let's say, you do complementary therapy and it helps with anxiety or it helps with stress, then of course that will have a very positive response also on our physical body. So I think that's it for now. And now that I've been talking about all these healing modalities, this kitty cat just fell asleep, and he's very, very comfortable and very calm. And so I invite you to come and listen to all the different modalities that I will cover, because I think it's just so nice that we have choices, that we can explore different ways of healing ourselves, meaning of so many different things, in a healthy, in an educated way, and also with people who are trained to do so. I mean, just think about psychotherapy, for example. There's so many different types of psychotherapy. And maybe someone really would like to see somebody that does Adlerian therapy, but maybe someone likes Jungian therapy, or let's say somebody wants to be psychoanalyzed, and which takes a lot longer, but that's their comfort level and it works for them. So I can't tell you what is the best thing for you, but I know that you can explore, you can find out, and there's many professionals who are very well trained that can help you in all the different things that to make us better as human beings and live a full, functional, healthy life. And on that note, like just this kitty, it's time for me to go to bed and have a good night's rest. And I hope you join me. And as you join me, please, I do have a special request that you do subscribe to my channel, that you do like my videos. And if you have any comments, please do leave some comments. And I think I mentioned this in another video. Soon I will also will be doing some meditations from my Facebook business page and also on my website. So look out for that as well. That's still in the works, has to be organized because we have to find the right dates and all the different things that go with it, but it's in the works. So good night, be well. And yeah, let's get on with more learning about all the different modalities. Take care, bye-bye.